Book 2, Hospital Admission and Transplant. In most cases, your transplant team will admit you to the hospital to begin the conditioning regimen about a week before your donor stem cell collection, whether it's a relative or not. You will be receiving your chemotherapy while they are preparing for donation. Before admission, the doctor will have to explain in detail the treatment plan, the risks, benefits, and expected side effects to you. At the end of this discussion, you must sign consent forms for the following: your chemotherapy or radiation and allogeneic blood and marrow transplant, any transfusion of blood products, and this is called informed consent. Let's look at what to pack for the hospital. This video and the accompanying series of booklets, comfortable and clean pajamas, loose sweat outfits, t-shirts, socks, underwear, slippers, gown, and tackies. Clean clothes must be worn every day after your daily shower, and hospital gowns are always available. Also bring a soft head cover such as a scarf, a hat, or a beanie. A brand new soft toothbrush and dental floss, and personal assistive devices such as your glasses, hearing aids, walker, or a cane if required. Some activity items. You can bring some books, crossword puzzles, laptop computer or tablet, etc. Some pictures, calendar posters, etc. to decorate your room. Maybe a special project, a scrapbook, a journal, or knitting, etc. Some newly purchased magazines, and your cell phone and charger. But please note that bringing expensive items to the transplant center is done entirely at your own risk. And of course, what not to pack. Do not pack any crafts that require the use of sharp needles. No needlepoint, for example. No razor blades, cuticle scissors, nail clippers. Remember, consider clipping your nails short and manicuring them prior to your admission. No jewelry. Makeup. Brand new makeup may be brought in and very lightly applied. No perfume lotions and creams, and no food, as well as vitamins, minerals, herbs, and probiotics. No fresh flowers or dried flowers or plants, and any other medications unless you are specifically told to bring them with you. What about customized patient care packs? The South African Bone Marrow Registry Patient Services Department initiated a care pack gifted to patients on admission to hospital for their transplant. The contents of the patient care pack is adjusted according to the age and gender of the patient. We took advice on the contents of the pack from previous patients and or their carers. The items recommended are things that could be helpful, supportive, and make a difference, however small, during the long stay in hospital. These include activity items, puzzles, games, or books, personal hygiene items, resistance bands, neck pillows, a flask, and stationery. The patient care pack is also available for sale from the South African Bone Marrow Registry. Family or friends who wish to sponsor a patient care pack may contact the office, and all proceeds go toward the Patient Assistance Program, which funds uninsured patients, mostly in state hospitals. Here's what to expect on admission day. First, your arrival. Your transplant coordinator will instruct you as to where to arrive for registration. Then registration and admission. Next is intravenous placement. You need to have a peripherally inserted central catheter or PICC line placed. Chemotherapy. Hospital routines in general. Your temperature, pulse, respirations, and blood pressure are regularly monitored and recorded. You will be awakened during the night for measuring of your vital signs. You will be weighed daily and early in the morning. This is also to help measure your fluid balance. The team will be keeping a careful record of your fluid balance. This includes all intakes, IV fluids and liquids by mouth, and all output urine, stool, and vomit. Do not dispose of any specimen before the nurse or clinician has seen it. Hygiene. You will be required to take a shower every day using an antibacterial soap. The nurses will cover your PICC line before you take a shower. Mouth care should be done at least 4 times a day. Personal hygiene is important in preventing infection. Your PICC dressing changes are done once a week and more often if needed. If it becomes loose or wet, let the nurse know right away. You will be in a private room. Everyone must wash their hands or sanitize before entering the room, and that the door must remain closed at all times. Let's look at chemotherapy conditioning in more detail. The conditioning chemotherapy is given in either high doses, remember myeloablative, or reduced intensity doses to kill the remaining cancer cells and chemically destroy your bone marrow to prepare it for the new donor cells. The drugs given are specific to the disease being treated. Conditioning regimens are an important part of the SCT process and are carefully chosen based on their intensity. Your doctor will consider factors such as your age, overall health, organ function, and your disease status to determine what type of conditioning regimen you will receive. What are the goals for this conditioning? Firstly, to make room inside your bone marrow for the new donor cells to grow. Secondly, to minimize the risk of complications during and after transplant. And thirdly, to prevent the disease from coming back and to promote transplant success. Most of the chemotherapy used in conditioning regimens cause severely low blood counts. When blood counts are low, you will be at risk for fevers, bleeding, mouth sores, and diarrhea. Nausea and vomiting can also occur with your chemotherapy. But medications will be given to reduce nausea and vomiting, and you can request additional medications if your symptoms are not well controlled. Additional side effects can happen that are specific to each drug, as listed below. Hair loss can be expected with each type of chemotherapy, but it will begin to regrow approximately 3 months after your transplant. Infertility can occur with each chemotherapy regimen, so please discuss this topic with your doctor in advance. Now let's look at radiation therapy. Not all patients will need radiation. If radiation is part of your treatment plan, the transplant doctor will refer you to a radiation oncologist for consultation 1 to 2 weeks before admission to the hospital. After the consultation, you will have measurements taken. A CT scan may be used to determine exactly where the radiation will be directed. Let's look at the different types of radiation that you may receive. Cranial irradiation. This is radiation that is focused on the head, specifically the brain, and the fluid surrounding the brain to eradicate any cancer cells that hide there. This fluid is called cerebrospinal fluid, or CSF. Total body irradiation, or TBI. This is delivered across the entire body. The purpose of TBI in allogeneic SCT is to kill any residual cancer cells that are not visible on imaging scans. It also may be used as immunosuppression. TBI will occur once you are admitted for transplant and is part of the conditioning regimen. Radiation oncology staff members will get you comfortable prior to starting the treatment. Once it starts, you need to lie very still. You will be alone in the room, lying on a stretcher during your treatment. The radiation therapist will be monitoring you on a screen just outside the room. You'll be able to talk to each other through a speaker. Treatments may be given as a single dose, or this may require up to 3 times a day for several days in a row. And each treatment lasts around 15 to 30 minutes. TBI is painless and the radiation cannot be seen. You will not be radioactive after you leave the room. However, there are often side effects from radiation which are similar to chemotherapy. Pre-medications will be given prior to your therapy to help prevent these side effects. All conditioning regimens also include a class of drugs called immunosuppressants, with chemotherapy and or your radiation therapy. They are used to do 2 things. 1, to prevent your immune system from attacking the new donor cells, and 2, to suppress the new donor immune system from attacking your body. We call this graft versus host disease, and we'll discuss this in more detail a little later on. All allogeneic SCT patients will receive immunosuppression therapy. This is critical to the success of the transplant. Allogeneic SCT patients must strictly adhere to their medication regimen, which includes daily immunosuppression. For most of these drugs, the level of the immunosuppressant drug in your blood must be carefully monitored to ensure that the dose is correct. This will happen while you are in the hospital, and at discharge you will be given important information about taking your immunosuppressants at home. Now, transplant day. Your conditioning regimen has been completed, and you should get some rest before it's time to receive your donor stem cells. And here is what you can expect on transplant day, and this is called day 0. Firstly, the infusion. The cells will be delivered to your room, and the color inside the bag may range from light candy red to dark red like blood. Your nurse may give you medications such as allergy and pain tablets before the infusion, and steroids may also be used. Your nurse will be present throughout the transplant infusion, and a transplant doctor and or nurse will be available throughout the infusion as well. Then the stem cells are infused into your PICC line, much like a blood transfusion. The infusion will not hurt. Your nurse will take frequent vital signs and watch for the potential side effects. This will include measuring the amount of oxygen in your blood with a pulse oximeter. The number and volume of bags vary for each patient. If the product was frozen, the stem cell preservative, DMSO, has an odor that will be present in the room for 24 hours after the infusion. It may help to peel an orange to help mask the odor. You will stop noticing this odor shortly after the cells are infused. Any visitors within that 24-hour period will notice the odor as well when they first arrive to your room. Most patients do not experience discomfort during their stem cell infusion. You will most likely feel tired from the pre-medications and sleep through much of your transplant day. This table shows some of the possible side effects and how they are managed. After the infusion, the donor cells will find their way from your bloodstream and into your bone marrow. Once they get there, they are like little seeds planted in the earth. They just need time to grow. When they do, they will begin the process of making new blood cells and slowly rebuilding your own immune system. This is called engraftment. Your blood counts will be checked every day. You can expect your blood cell counts to drop. Even after they recover, it is very important to follow the post-transplant instructions. The transplant team keeps track of how many days it has been since the infusion. The day after the transplant is day +1. A week after the transplant is day +7, etc. You will be closely monitored for a minimum of 6 months to 1 year after transplant, depending on how your recovery goes. Let's look at some emotional and social issues. This is often a time of mixed emotions for patients. Feelings that you and your family may have range from anxiety to hope. The length of hospital stay and medications used in the transplant procedure may cause feelings of depression and irritability. Feelings of loss due to your body's changes, hair loss, changes in skin color, are very common during this time. Patients and caregivers are encouraged to take one day at a time and focus on the long-term benefits of your transplant. It is helpful to understand what the plan is for each day and to stay involved. You and your family will be given every opportunity to discuss your feelings, concerns, questions, and issues with the transplant team at every step along the way. Social workers are available for counseling and emotional support. The hospital services can provide access to religious and spiritual care and support. There are also extensive online and written resources available for patients. Let's have a look at donating blood. Blood is an important life-saving resource. Most patients go through blood and bone marrow transplant will need blood and/or platelet transfusions. So often, family and friends will ask if they can help in any way. A wonderful opportunity exists to give not only to the patient, but to the whole cancer community. Call the Western Cape Blood Services or South African National Blood Services to find the nearest donor center or clinic to check their respective websites. One blood donation can save up to 4 lives. It takes 30 minutes to donate red cells and around 90 minutes to donate platelets. This guide is continued in Book 3, which is Post-Transplant Recovery.